Hi everyone, welcome back to the channel. In today's video, we will discussing about important case studies for the CPC exam. These questions are very crucial because they usually appear in the last 10 questions of every CPC exam. So it's very important to understand how to approach them and select the correct CPT codes. So let's start. This is the first question. Preoperative diagnosis, chronic otitis media in the right ear. Postoperative diagnosis, chronic otitis media in the right ear. Procedure, eustachian tube inflation. Anesthesia general. Blood loss minimal. Complication none. Indications. The patient is a 2-year-old who presents to the office with chronic otitis media, refractory to medical management. The treatment will be eustachian tube inflation to remove the fluid risk. Benefits and alternatives were reviewed with the family, which include general anesthetic, bleeding infection, tympanic membrane perforation routine tubes, and need for additional surgery. The family understood this risk and signed the appropriate consent form. Procedure in details. After the patient was properly identified, he was brought to the operating room and placed supine. The patient was prepped and draped in the usual fashion. General anesthesia was administered via inhalation mask, and after adequate sedation, incision was made on tympanum and thick mucoid fluid was suctioned. Patient tolerated the procedure. Option A, 69420 RT, B 69421 RT, C 69436 RT, D 69433 RT. Okay, the first step was, let's look carefully at what was actually done. So the report says incision on the tympanic membrane, section of thick mucoid fluid, no tubes inserted, general anesthesia was used. Even though the pre-operations note mentions eustachian tube inflation, the procedure actually performed is a fluid removal. So then understand the CPT options. Option A, 69420, meningotomy with the tube, no anesthesia, so it is wrong. Anesthesia was used in the question. 69421 is meningotomy with the tube with anesthesia. So this is the correct answer. Then 69433 is removal of tympanostomy tube. Tube not removed. So this is also wrong. Then option D, 69436, eustachian tube dilation. This is also wrong. No balloon or catheter is used in this case. Even if the report mentions eustachian tube inflation, CPT coding is based on what was actually done, not what was planned. Okay. So the correct answer is B, 69421. Remember, always focus on the actual operative steps. Tube insertion or balloon dilation must be documented to use 69420, 421 or 436. Section alone under anesthesia comes 69421. So this is the correct answer. Don't get tricked by the wording like eustachian tube inflation. Carefully read the question.